Hi guys. So I mentioned in my intro video that I have medical problems. Um, I have heart disease. I could remember, being 5, 6 years old and feeling my heart, jumping around like there was a fish in my chest and mentioning it to my mom and no big deal. Oh, you'll be okay. You're probably running around, you're fine. Um, I wasn't fine. I would pass out. I would have a lot of issues. I think my mom finally brought me to a cardiologist when I was 14, maybe 13. I can't remember. I just know I was young. Um, no, you're great. There's nothing wrong with you. You're young. So it was basically put in the back somewhere. Years down the road, I was still having issues passing out, feeling my heart race. Sometimes I couldn't breathe. It felt like there was just something sitting on my chest, and it was the scariest feeling. Um, when I was 14, 13 years old, I was in a coma for many hours, 13 and a half, 14, 15 hours. Doctors never knew why. They tried to blame it on me taking too much medication as an overdose. It's not what it was. We still don't know what it was. I'm assuming it was something with my heart and lack of blood flow. I don't know. Um, when I was approximately 15 or 16, I can remember being brought to the ER because my heartbeat was way over 200, which normal is, 80 to 120. But resting should be about, 60 to 80. Um, Mine typically runs resting about 130. Um, I can remember when I was pregnant, I could just feel my heart racing and just I couldn't breathe, and it was everybody would say, oh, it's because you're pregnant, you're getting bigger, you can't breathe, you're pumping more blood through your body, blah, blah, blah. Same crap. Cardiologists would say the same thing. Oh, you're fine. We're not going to do an echo. We're not going to check you out. No EKG. You're fine. You're young. You're healthy. Um, After I gave birth to my kids, I can remember with my daughter in particular, laying on my bedroom floor and feeling like an electrical shock with each heartbeat for about 10 minutes. And I thought that was it. I thought I was going to die. Obviously, that wasn't it. Um, Countless cardiologists, everybody all said the same thing. You're young, you're healthy, you're fine, there's nothing wrong with you. Um, I started having a new symptom to where I would get a migraine so bad that I would go blind. And I tell you what, it scared the shit out of me. The pain that I would have was incredible. I've given birth 5 times. 3 out of those 5 babies were absolutely no pain meds. I handle pain very well. I am covered in tattoos, piercings. I mean, I am fine with pain. Nah, not with that. Um, it was horrifying, especially going blind. That's what scared me more than anything. It would just slowly, it would be like strobe lights in the corner, and it would just eventually just go black. And then it would take about 30 minutes, and I'd get my vision back, and I'd have the worst migraine imaginable, and I would have to force myself to try to fall asleep as I was going blind before the migraine kicked in, or I was never going to be able to sleep for hours and hours, and it was just bad. I think it was about the 10th cardiologist. I said, that's it. I'm done. I'm not going anymore. I've had enough. I'm tired of hearing the same thing. I'm tired of wasting money. Nobody wants to listen to me. So I swore off cardiologists. And I just dealt with it. My husband read in the paper one day that a cardiologist discovered that um, if you get those particular type of migraines, it's been discovered that a lot of people had holes in their hearts. And I'm not sure if people are, who's familiar with hearts, but there's a left side and a right side. There's an atrium and a septum. Septal. There, I have something called an ASD, an atrial septal defect. So the top of the two chambers had a hole in it, and it was the unoxygenated blood that goes down into the bottom of the heart, goes through the lungs, gets oxygenated, that goes back to the heart and up to the brain, wasn't getting oxygenated. It wasn't going through the lungs. It was going straight through the hole into my head and causing a migraine, which is how strokes happen as well. I'm very lucky I didn't have a stroke. Very lucky. So, anyways, um, my husband finally convinced me to go. Several weeks of arguing about it, I finally gave in and went, and sure enough, they did an echocardiogram, which is an ultrasound of the heart, and they're like, oh, everything looks fine. I don't see anything weird, but let's just do one extra study. It's called a bubble study. And it's basically you're getting an IV in your arm. They shake up the saline into a little syringe, they push it into your IV. You hold your breath, you bear down, and if it goes through to the other side of the heart, you obviously have a hole. Well, the doctor didn't think I had one because, the echo showed it was fine, but the minute they did the bubble study, they saw I had a pretty significant size hole. And that next month, I was having surgery to close it. I don't have a big scar going down my chest, thank God. They went through an artery in my leg and put a little metal occluder. It's like a little mesh thing that they put into the hole and closed it up, pretty much. I was still having issues, still getting migraines, still passing out. I could feel when I would pass out. I'd get very tingly. My vision would start to go. I'd need to sit down. My heart would feel like it was stopping. It was going so slow. I went back to that cardiologist and he said, I fixed you. There's nothing else I can do for you. There's nothing else wrong with you. Get over it, pretty much, without saying it like that. So again, I went home and I swore off cardiologists. It got bad to where even walking up the stairs, I couldn't breathe. I was passing out. It was pretty bad. Not a lot of people know how bad it was. I did hide a lot of it from my husband. Because I didn't want to be a complainer. There are a lot of things I do complain about, and I didn't want him to be like, oh, this is just one more thing to complain about. So I hid it from him until it got really bad, and I finally found a new cardiologist. I heard good things about, amazing things about, and he put me on a Holter monitor for a month, and it was about 2 weeks later I was at work, and I felt my heart starting to slow down, and I was going to pass out, and it was hooked up, the Holter monitor was hooked up to a cell phone, a pager, or something like that, and immediately sent the information to the doctor. And within an hour, I was getting a phone call saying I was getting a pacemaker the next day. Scared the shit out of me. My heart was stopping for 10 and 20 seconds, and it was going so slow, which was causing me to pass out, and it was lack of blood flow to my brain. Immediately called my husband, was crying, terrified, called my family. Got the pacemaker the next day, which was absolutely terrifying. Was in the hospital overnight. I did ask them to give me a little extra Versed in the cath lab so I wouldn't remember anything, which was amazing because I didn't. I do remember them wheeling me in there, putting the AED on me, all these different pads on me, and that was it until afterward when they were waking me up saying, look at your x-ray, that's your pacemaker. I do have this nifty, ugly pacemaker. It's a pretty gnarly scar too, which it's gotten very thick because unfortunately being female, when you have breasts, it pulls down the skin and makes it thick. Instead of doing a diagonal line, they did horizontal, which was not the smartest thing, but I guess that's the standard. I think it was 2 days after I got home. I had a complete heart block. Forgot to tell you what it was called. It was a complete heart block, a 3rd-degree heart block, which was why my heart was going so slow. The electrical activity that goes from the top of the heart to the bottom of the heart was not making it to the bottom of the heart. So just the top of the heart was pumping and not the bottom, which pumps the blood up to the brain, hence the passing out. So a few days after I got home, I felt my heart racing very, very fast. We went to the ER. It was very fast. They immediately brought me back to the room, hooked me up to the AED, gave me a medicine which sucked. It's called adenosine. It's pretty much a medicine that kickstarts your heart over. So you pretty much go flatline for a minute, you start over, so you don't have to get shocked. It's a medication. Unfortunately, in my case, because I have a pacemaker, it will not allow my heart to go below a certain number, so it wasn't working for me. I think it was the 3rd round of adenosine. They finally said, that's it. Let's just give her IV medications to keep her heart rate, a little bit lower till we could figure something out. I was in the hospital for a few days. That was it. I was good. I still have issues to where once a year I'm getting hospitalized in the cardiac ICU. I was in there last year for a week because they thought my heart was going to stop. My potassium got so low that it was very dangerous level to where they put me in the cardiac ICU under very close observation. Had a few hiccups during that time while I was in there. Heart rate going too fast, going too slow, going too flat. I give up. So far I'm okay. Like I said, I still have issues. I had a cardiac ablation last November because of it still going way too fast. They could see it because obviously a pacemaker's like a computer. Every 6 months I go to what is called a pacemaker clinic. They sit like a little wireless device on my pacemaker and it shows them all the times my heart went nuts. Exactly if it was like an AFib, a tachycardia, bradycardia, just everything. It shows what time of day it was, how long it lasted, and they saw that I was having many episodes of it going too fast, which is not good either. So I had a cardiac ablation where they went through my femoral artery in my leg and they burnt the inside of my heart, which, holy shit, I thought I was going to die because they could not sedate me enough, and the burning sensation, oh my god, that immediately woke me up from the sedation that I had. I remember everything. Never again will I get an ablation in my life. Even the doctor apologized tremendously afterward, like, I'm so sorry, we couldn't get you sedated. They should have just knocked me the hell out and intubated me at that point. Anyways, whatever, there's nothing they could do about it. I was on a billboard with the American Heart Association because they do consider me a survivor. I don't consider me a survivor. I'm just, somebody that has a heart problem. There's tons of other people out there that have it worse than me, that need new hearts, that have open heart surgeries, which I hope I never ever have to have.